International Journal of Health Policy and Management. Quality and speed are our culture and the keys to our success. Welcome to the audio summary section of the International Journal of Health Policy and Management.
My name is Nathaniel Lohman, and on behalf of a team of authors including Amy Hagopian, Samuel Laboga, and others, I'm here to present a brief summary of our paper entitled District Health Officer Perceptions of PEPFAR's Influence on the Health System in Uganda between 2005 and 2011. More than 10 years now since the inception of the US President's Emergency Plan for AIDS Relief, also known as PEPFAR, there is general consensus that it's been successful at achieving its main goal: to reduce the morbidity and mortality due to HIV/AIDS in targeted low-income countries. Among other positive effects, PEPFAR increased equity and access to antiretroviral treatment, raised standards of care, and improved diagnostic laboratory capacity. However, the jury is still out as to whether or not PEPFAR was also able to strengthen broader health systems overall. To address this knowledge gap, our study gathered textual data characterizing Ugandan district health officers, who were referred to as DHOs, perceptions of how PEPFAR affected health system strength in Uganda between 2005 and 2011. We hypothesized Ugandan DHOs would perceive PEPFAR strengthened the health system overall, particularly in the areas of health workforce training, improved access to medical supplies and equipment, and improved financing for the health sector. At the same time, we also hypothesized Ugandan DHOs would perceive PEPFAR implementation prompted the movement of health workers out of the public sector and potentially increased focus on HIV/AIDS related activities at the expense of primary healthcare delivery. We asked Ugandan DHOs at each district health office to categorize whether PEPFAR's effects on 7 separate health system components had been positive, negative, or neutral. We then prompted each DHO to comment on the effects of PEPFAR on each health system component studied. The health system components we looked at were modeled closely after the World Health Organization's building blocks for strong health systems, and listed in the order they appeared on our interview guide. They are planning capacity, monitoring and evaluation of non-HIV programs, resource mobilization, management of medical supplies and equipment, human resources for health, coordination of stakeholders, and management of information. We identified key themes and sub-themes from among the responses using open free coding and analyzed these themes using a content analysis approach. As far as findings go, Ugandan district health officers generally reported PEPFAR investments between 2005 and 2011 had been helpful for the country's overall health system. When asked to categorize PEPFAR's overall effects on health system components as beneficial, detrimental, or having had no effect, 79% of respondents reported that the effects had been beneficial. 8% reported that they had been detrimental, and 9% reported no net effects. An additional 4% either did not know or reported mixed effects. Examining DHO's perceptions of PEPFAR's influence on each health system component individually, respondents in large numbers, again between 78 and 92% depending on the health system component, reported that PEPFAR's effects had been beneficial for 6 of the 7 health system components studied. DHOs most often named capacity building as a key theme, which improved all health system components studied. The second most often named positive effect was the opportunity to integrate HIV and non-HIV activities. Respondents reported that the integration of services was most important to the health system components of monitoring and evaluation capacity and planning capacity. Thirdly, DHOs said the direct provision of medical supplies and equipment and of staff allowances, whether through the integration of HIV programs and non-HIV programs or through direct support for non-HIV programs, was a major positive effect of PEPFAR. At the same time, many DHOs reported PEPFAR's vertical nature and narrow focus came at the expense of or did not significantly address or sufficiently address public health priorities other than HIV. Many DHOs critiqued the verticality of HIV programs while acknowledging positive spillover from those programs to non-HIV programs as well. DHOs Also reported, PEPFAR increased the workload for an already overburdened health workforce. With the scale-up of HIV services, district health offices face the consequences of their own success in many ways, seeing an increase in the number of patients seeking care for both HIV and non-HIV services alike. Beyond the heavier burden of work and challenges filling vacancies, DHOs also saw the disparity in salaries between NGOs and the public sector as harmful to morale. We conclude, Ugandan DHOs reported PEPFAR strengthened their health systems between 2005 and 2011. However, DHOs were not unanimously or uniformly positive. As HIV infection becomes a chronic disease requiring strong health systems to manage sustained patient care over time, Uganda's weak health system will require broad infrastructure development, inconsistent with narrow, vertical health financing. Nonetheless, health system leaders in Uganda at the district level were appreciative of resources aimed at HIV that they could often leverage for broader purposes. Thank you.